Good afternoon. Thank you for this opportunity. It's a great honor for me. Also, great time to see old friends and new friends. So today I'm going to talk about adipose-derived products for regeneration and rejuvenation. My disclosure is research funding from some companies, and also I'm involved in a venture company based on my university. What is the role of stem cells? Stem cells, we have 1 trillion cells in our body, but each cell has its lifespan. So about 200 millions of cells are dying every day in our body, and also 200 millions of cells are being born from stem cells. So stem cells govern tissue homeostasis and repair. And regeneration is ongoing every second in our body. So if stem cells are functionally in trouble, our regeneration and homeostasis will be in trouble. So even when stem cells are functional, if disease, some inflammatory disease, ischemic disease, autoimmune disease continues, stem cells will be continuously activated every second, and then finally they will be exhausted. That's a big trouble to our function, to our tissue and organs. So the radiation or inflammation, ischemia, autoimmune disease, dystrophic disease, and finally our tissue will be stem cell depleted, so exhausted. So that's for those conditions, stem cell supplementation is the right way to treat this condition. Okay? And radiation, talking about if radiation, actually regular injury kills adult cells, then stem cell will be activated. But the opposite, the radiation injury kills dividing cells. So which means cancer cells are dividing more frequently, and also activated stem cells are dividing. So that's why radiation kills stem cells, but not adult cells, which means it is okay, it looks okay now, but the tissue will be in trouble in a year or in several years later. So radiation therapy induces stem cell depletion, and radiotherapy leads to deterministic and progressive dystrophy or dysfunction of the radiated tissue. So devitalization, we call such condition devitalization. After radiotherapy is progressive, which means after radiotherapy, the tissue wound healing, it's an acute phase, but it's chronic phase. The function will be impaired over time, progressively over time. So regular damage, stem cells are normal, so even acute phase we see, but function will recover after 3 months. But radiation damage, we see acute phase, but it will partly recover, but it will be progressively impaired because this is stem cell depleted. That's the difference. So those conditions are ischemia and impaired wound healing, scarring, stiffness, no expandability. If it is serious, we see some skin ulcer or osteomyelitis. So very challenging condition for surgeons. So therapeutic benefits of stem cells, we need to know. If simply speaking, direct effects, we need autologous stem cells, but this is fertilized tissue organs. So which means stem cell depleted condition to stem cell normal condition. So poor soil to rich soil, we can change. So that is the stem cells are, source of power of the tissue. So indirect effect is through secreted factors from stem cells, which includes promote angiogenesis, reduce inflammation, and reduce fibrosis. Those purposes are done through secreted factors from stem cells, which means stem cells from even allogenic stem cells can work for these purposes. So we have many adipose-derived therapeutic tools. Of course, plastic surgeons started with fat grafting, simple fat grafting. We know the micronized adipose matrix, like a nanofat, so many brand names. Those are obtained through mechanical processing, just to remove adipocytes. So through chemical processing, we can obtain a cellular dermal matrix. This is commercially available in United States as a powder or seed or gel. Through enzymatic digestion, we can obtain freshly isolated stromal vascular fraction, and sometimes can be used for the cell-assisted ribose transfer. And also we can culture and purify some important stem cell population. One is adipose stem cells, and one is adipose endothelial progenitor cells. So those banked cells can be used for cell therapy in the future. So through this culturing process, we need culture media exchange. Then we can obtain culture medium is being discarded every 3 days. So that's actually waste, but still it contains very important factors released from stem cells. So now we are manufacturing secretome extract, only condensing the very important factors from stem cells. Even simple fat grafting can work. Just for example, the androgenic alopecia, just we inject fat grafting to the under the scalp, then we see this kind of clinical effects in some patients. This is a radiated tissue, so non-healing skin ulcer of the breast, but just debridement and doing fat grafting to the surrounding tissue, then wound healing capacity can be restored. Then wound easily contract and heal. So this means this is poor soil, and we can change rich soil, then wound healing start. This kind of effect. So this is a radiated breast. So after partial mastectomy, breast cancer patients, then it is hard, ischemic, but now the tissue becomes more elastic, soft, and more vascular, so patient can feel warmer than before. Those are progressive improvements after fat grafting we see. So how about the prophylactic use of stem cells? Prophylactic means to prevent the development of chronic radiation disorders. So this means treatment is immediately after radiotherapy. And we do some studies to which it can prevent radiation chronic damage. Then we see the no treatment, there is fibrosis, atrophy, but if we do fat grafting or stem cell grafting or non-fat grafting, we see some improvement, the effect to prevent development of chronic disorders. So this is an example of mechanical processing of lipoaspirates. And some devices are commercially available. Those are the preferred by European cosmetic or plastic surgeon because they have a very severe stem cell regulation. So that's why it's very difficult to use stem cell in the practice. So they are using this kind of devices. We can, through digestion, enzymatic digestion, we can get, this is a stromal vascular fraction we call. Then we can purify two cell population. One is adipose mesenchymal stem cells, and the other is endothelial progenitor cells. Then we can use to treat the radiated tissue, and stem cell injection can work, and also endothelial progenitor cell injection can work. And also we can see some synergistic effects by using both stem cells and endothelial progenitor cells. This is our country's stem cell therapy regulation. The cellular products are categorized depending on the potential risk into 3 categories. That is the class 1, class 2, class 3, and no regulation. So 4 categories. Class 1 is allogenic stem cells or iPS cells or embryonic stem cells. Those are class 1. And class 2 is just cultured stem cells or even non-cultured cells. If it is used for non-homologous purpose, it can be categorized into class 2. For example, adipose stem cell inject into joint cavity, that is non-homologous use. Class 3 is a fresh non-cultured stem cells for homologous use is class 3. So class 1, class 2, we need registration and approval by special committee. And class 3, we need only registration to start treatment or clinical trial. But the processed tissue, like a nanofat, like a mechanical crushing, freezing, sewing, deserialization, or culture medium, those are not regulated. So we can use without registration or approval in Japan. Then there are these numbers, protocols are already approved in Japan. And this is adipose derived number. And this means class 2, about 50% of protocols are using adipose stem cells. So it is adipose stem cells are most popular, and hundreds of clinics are performing stem cell therapy in Japan now. So our outsourcing difficult part is cell processing, banking, cell culture, manipulation. But this kind of troublesome part can be outsourced. We have a new industry, cell factory or cell laboratory we call. So a physician can easily outsource, just send in the tissue sample, and then they will prepare cellular products for physician. So cellular products are returned to physician, then they can provide cell therapy to patients. So this kind of system we have, that's why there are so many clinics are providing stem cell therapy in Japan. So therapeutic benefits of stem cells I already introduced. So fertilized tissue and organ. So changing poor soil to rich soil, this is most important. So, but we need autologous stem cell because stem cell need to be implanted and survive in the tissue of the patient. But other benefits like a promote angiogenesis, reduce inflammation, reduce fibrosis, those purposes are done through secreted factors, which means if our treatment purpose is those purpose, we can use not stem cell, but just secreton. So soluble factors released from stem cells. So when culturing stem cell release so many growth factors, enzymes, inhibitors, or exosomes, some very important factors for regeneration. But they also release toxic factors. That is ammonia, toxic ingredients. For example, we have to change culture media every 3 days. If we house fish in our house, we need to change water every two weeks because they are releasing ammonia, toxic factors. That's why we have to change. So actually, if we culture stem cell for 1 week, stem cell condition media contain very high ammonia. So it is very toxic. That's why we have to remove those toxic factors before use. Also, we have to avoid infectious virus from the donor. And of course, we cannot use animal-derived products in the process of cell culture and expansion. So then we can, so there are the previous speaker introduced about the PRP and basic FGF. Those are how different from secreton of those stimulators. We can call those factors stem cell stimulators. PRP contain mainly PDGF and EGF. Those are breeding signal to activate sleeping stem cells. Because breeding means emergency in our body. So the FGFs are injury signal. They can be released from a ruptured extracellular matrix. So those are the immediately released after bleeding and after rupture of tissue. Then they immediately activate sleeping stem cells. Then sleeping stem cells wake up. Then they start to manufacture those factors. And all those factors are contained in secreton. Then those work to regenerate the tissue and organs. So that is the system, the difference. So we can use stimulators for regeneration, and we can use secreton for regeneration, depending on the purpose. So we need stem cells if we use stimulators, but if we use secreton, we don't need stem cells because we can start the regeneration without activation of stem cells if we use secreton. So now we are manufacturing a stem cell product and removing the toxic factors and concentrate the beneficial factors like freeze-dried powder, and also it's a liquid form product and it is already registered as a cosmetic ingredient, not pharmaceuticals. I'm sorry. So we are doing a clinical trials in Japan, but not yet approved as pharmaceuticals yet. And we can use as, for example, eye drops for the pets, lotion, skin lotion for the atopic dermatitis. And we can use those liquid, and this is the stem cell secretome, like a steroid, because they can reduce inflammation. Also, infertility is a huge social problem in some Asian countries, like South Korea and Japan, because birth rate is very low now. So our population is shrinking every year. So that's a huge problem, and that's why in vitro fertilization, many women having. So, but the IVF success rate is only 15% so far. So one of the reasons of ancestral case is atrophy of the endometrium of the uterus. So if we can inject into the cavity of the uterus, then we can hypertrophy the endometrium, then this is much better condition when we implanting the egg. So this is also one of the application for the future. So we may help to avoid infertility in our society. So the therapeutic tools, including stem cell, we have lipoaspirates to use fat grafting, micronized adipose matrix, like a nanofat by mechanical processing, and also we can use secretome, exosome. This includes no cells, so non-autologous liquid is also can work. And non-cultured stromal vascular fraction or cultured stem cells or anterior progenitor cells. So in the future, we are thinking there are two main ways. One is secretome. It's non-autologous. So it's from others, so which means we can mass manufacture very easily and 100 cheaper compared to stem cells. But stem cell depletion, exhaustion, we need to use autologous stem cells. But other purpose, we can use secretome. But for this purpose, we have to take stem cell from patients and strictly regulate it. So that's why to perform this treatment is very expensive. So those difference we see. But there are two ways depending on the purpose of the treatment. Even our life, aging, is stem cell exhausting process. We have a stem cell, largest number of stem cells at birth, but the number of stem cells quickly drop in the first 20 years to make our body adult, physically adult. Then our growth stopped, physical growth stopped, but we are using stem cell little by little, every day, every year. And finally, our stem cell depleted, exhausted, then we have to die. So we need to save money for our life, but also we need to save our stem cell for longer life. So this means stem cell replacement therapy may work to expand our lifespan. So stem cell replacement therapy may be also in the future for a longer lifespan. So stem cell depletion, exhaustion is a big problem for us, and radiation quickly kill stem cells, and cancer drug quickly kill our stem cells very fast. But the inflammatory disease, ischemic disease, autoimmune disease, dystrophic disease, these continue activation of stem cells, and gradually stem cells will be exhausted. And even aging is very slowly, but still exhausting stem cell process. So those purpose we need autologous stem cell supplementation. Next year we are having a triple event, research, 2 rooms, fat and stem cells, 1 room, and aesthetic anti-aging 1 room in Tokyo. It is very close from the Haneda airport. So I hope many Chinese doctors can come to Tokyo to attend those triple combined events. Also those live streaming, so you can enjoy even from China, like watching a TV of a 4 channel. You can change in the 4 channel at the same time. I hope you can join and discuss and or even show your outcomes in this event. Thank you so much.